And so, emotions and feelings. Here you see the table of clarifications. Well, as you see, emotions, and let me make some notes. Emotions is from the right, and this is a physiological response. The response of our body for event or for anything. This is the response of our body. And who or what is responsible in our body, what creates emotions. And you see that they are created in subcortical region, particularly in amygdala. Well, not only in amygdala, of course, but the amygdala is the center of subcortical region in which the nerve nodes are concentrated, and these areas of neurons, these organs of the central nervous system, part of the central nervous system, they are responsible for the creation of the emotional reaction. For example, if you see the snake, automatically your amygdala become excitated. And after that, amygdala send a signal to the spinal cord, to the internal organs to react immediately. So increased heart rate, increased muscle tension, jump out, increased orientation, increased sensitivity. So just run and save yourself. That's it. This is the function of emotion, is to react for the environment, actually to save your life. But not only. And what is the feeling? The feeling is a positive or negative reaction for the experience of the event. Actually, feelings, it's our recognition of emotion. So, animals have emotions, but only human beings have feelings. So, feelings, it is recognized emotions. Then emotions, then we become aware about the emotions. Then we can speak about that, or we can at least say to ourselves, what is that? I'm angry, I'm sad, I'm happy, I'm joyful. This is a feelings. Then you do recognize it, what's going on. As you see, sometimes we have an emotion, but we don't recognize it. And you very often can see your friends, somebody who around, they feel tensed, but if you ask them, are you okay? They tell you it's okay. But you see that not okay. You see it from the signs which goes from their body. The eyebrows are joined together. The jaw muscles are tensed. For example, they have a clenched teeth. They're angry, but they say it's okay. Sometimes we even do not recognize our emotions. In this case, looks like we have no feelings, but actually these feelings is just hidden from us somewhere in us, but we don't recognize it yet. As you see, the feelings, they originate from neocortical region, and this is our awareness about the emotions. Let's make a small pause. I have to answer the phone. Mm-hmm. I see that. Sorry. Looks like I should explain this again. Sorry. Another process is running in this room, so it distracts a lot of. Again, emotions. Emotions, it's a biological state. Biological state of the amygdala. What amygdala do to us? If I feel anxiety, or if I feel desperate, or if I feel sad, these feelings interrupt my perception. And I see around me only negative things, which prove, yes, the existence, which prove that it is necessary to feel anxiety, which increase my anxiety. I only circulating in a negative thoughts, in a negative perceptions, and I see only negative things around me that support my anxiety. But what do we do in a psychotherapy? We work with the feelings. We cannot change directly the emotions, but we can work with the feelings. So we can work with that. Do you see your anxiety? And if you see this anxiety, can you separate yourself? Can you step back from it? Let's admit one thing. We cannot change the anxiety right now, but we can observe it from the side. And we can, together with the patient, we can study how this anxiety improve itself, support itself. And we see the pathways of the anxiety, we see the circles, and we break them. By what? With the mind, with the awareness, with the cortex, we try to find contra indications. We try to find something which give an opposite, which can give an opposite emotions around. For example, a person with depression can say, I can't do anything. And he believes that he can do anything. But by the interaction with his feelings, with his mind, we can ask him, is it so? We can think together and we will see, yes, you can do. You came to me for the counseling. You seek for the help. So this is your power. Where else is your power? That you see your problem, that you know that you're capable to find the roots of your problems and other things. And let's look around. Is there any positive? Is there any strength in you? And then he or she put her or his attention for these powerful things. He make them work, and that gives him a positive feelings. And these positive feelings, now they have a competition with that emotion. And what happens? Here we have an anxiety, and at the same time, a person can feel something positive. An anxiety, if we leave it without attention, if we leave it without support, additional support will go down, will become smaller, and positive emotions become, let's say so, they become dominant emotions in the brain, and that how we can psychologically reduce negative emotions and introduce or initiate positive emotions by analyzing the feelings of the patient and everything what's going on around the feelings of emotions of this patient. We will talk about this a bit more than we will talk about anxiety. Here is the anatomical substrate, subcortical neuronal centers, which are responsible for creation, for the supporting, for the circulating of the emotions. And you see, they are all located in subcortical area in the encephalon. It's a corpus callosum. It's cingulate gyrus. As you see, it's a part of thalamus, hypothalamus. It's a thing which is responsible, and amygdala. What is it that about? All these structures really deeply involved in the regulation of the so-called vegetative functions in the regulating of the physiological functions. See? And evolutionary, they are predecessors of the neocortex. So all the animals which are not so developed as a human or as the apes, all these animals, they have these emotional center as the main center of the regulation and the main center of the making of decision. What that means? So their emotional mind decides what to do next. Is it they have to run, or they have to fight, or they have to do something else? But our limbic system is not only created to feel fear or anxiety, it's also created to make us feel joy and love. And evolutionary psychologists, they gave not so recently, quite a long time ago, one simple theory that love is a very powerful instrument, very powerful tool which led animal to survive. And that's very simple. If you love your couple, if you love your tribe, if you love your springs, children's, so you will take care of them. And if you take care of them, of your, let's say so, of your family, of your close one, of your friends, that means we will survive. Our chances for the success in surveillance is being increased. So a limbic system is being created to react with the fear, with the anger, and also it is being created for the love and for care. That its function, the functions of emotions. Again, to form a positive attitude and to form the negative attitude. This is the function of emotions, and unfortunately, not all of them, actually all of them, is out of a direct control from our cortex and from our mind. And our mind is very often is a slave of our emotions. And you can look at yourself in your own example. Then you said your mind is working not to take you out sometimes, but very often it works to pull you deeper in the sadness, because your mind can very sophisticatedly find the reasons to prove that you're bad, that you loser, that there is no good hope for you, etc., etc. It's because emotions, they lead your mind, not your mind lead the emotions. And it's very difficult to make it in opposite direction. Okay. Now a few more terms like a mood and affect. So mood, as you see, it is sustained emotion. Sorry, sustained emotion that control the perception of the world, that control your behavior. So it's a long time emotional state in the person. For example, for the last week, if he was in a low mood, that means in the majority of time he was in a low mood. Yes. But affect, it's a short-lived emotion, intense emotion, which actually we cannot hide because it's too strong. We cannot hide it, and that's why our emotions take control of our behavior. These emotions overcome suppressing of mechanism, and we behave accordingly with that what these emotions want from us. If we're angry, we shout. If we're sad, we cry. If we feel joy, we will laugh. We will be excitated, and we cannot stop ourselves until a particular period of time. So at the current moment, these emotions, if it dominates, if it's too strong, we call it affect. Please don't mix it, okay? So now, after we acquire these terms, let's move to the classification of the disorders of the emotions, to the particular classification of the disorders of emotions. And here we see normal emotional reactions, abnormal emotional reactions, abnormal expression, morbid expression of emotions. This is a bit mechanical classification. Usually they combine one with another, but maybe it will help you to acquire easily all the necessary required knowledges. Normal grief reaction. First of all, what is the grief? Grief is the reaction for the loss of something valuable, like somebody close had died, like you lost your job, like you lost a family, it's a divorce. It could be a divorce. It also could be then the children's leaving a house, or in a children's, then they leave a house. It's also kind of a reaction of loss. But usually something terrible have to happen in order to induce, to expose a person to the grief. What is a normal grief? What is abnormal grief reaction? Abnormal grief reaction is something which is go beyond the frames of a normal grief reaction. So what is a normal grief reaction? See that maximum period is 6-12 months, depending on the culture. Usually in Western cultures, they say that it takes from 2 to 4 months. And then a grief reaction should not evaporate, but should be not so intensive, not to affect a life of a person. Not so much intensive. How do they measure that? They found that in acute period of a grief reaction, a person experiences some autonomic nervous system changings, like the most of the people experience the overactivation of the sympathetic nervous system. And also parasympathetic nervous system can dominate, but actually it's in a long period of time after domination of the sympathetic nervous system. As the compensation, a parasympathetic nervous system becomes in charge. But this period of the overactivation usually takes from 2 to 4 months. Then should start recovery. But mental recovery, spiritual recovery, psychological recovery from the griefs appears a bit longer than this period. As I said, 6 months. If it goes longer than 1 year, then this person requires help. Second, normal grief reaction is are not accompanied with dysfunctional behavior. So behavior, yes, a person can be retarded. A person can be slow, uninitiative, uninitiative, can lose his energy for some period of time, but he shouldn't do something like a suicide, self-damage, the damage of other people. He should not forget about his duties. Like, for example, if mother is in grief, so she have to continue to take care of the children. Yes, that will be much more difficult for her to do this, but she cannot abandon them, and just especially if they're too small, too young. It's impossible, or not impossible. It's possible, but that will be abnormal. And also, again, people have to continue to go to work if they work, have to continue to go to study if they study. If they cannot do this, this is a signal that this person requires additional help, support from the mental health professional, psychologist, psychotherapist, or even psychiatrist. Let's move to the pathology. We have abnormal emotional reactions. So this is understandable, natural reactions for the event, but they are too long. And these reactions, as you see, do not differ qualitatively. So these reactions are the same reaction, and in the majority of other people, if they would have been exposed to the same condition as this person who experienced abnormal emotional reactions. And now let's go for the main example. It's anxiety. Anxiety, that's the axis of all the pathological feelings, all the pathology, psychopathology in the human beings, but not only psychopathology, also the somatic pathology in the human beings. As you know, in anxiety, we have undoubtedly the increased amount of the hormones, glucocorticosteroids in the blood. It's constant, it's too long, it's endurable, so it exists for a long period of time, and it can cause a physical harm for the person if this person suffers too long from the anxiety. So let's go from start from the definition of anxiety, and I would like you to remember as the prey, as powerful as the prey, that anxiety is the fear for uncertain reason. This is uncertain reason, the fear of uncertain reason. Uncertainty is the second name of anxiety, and anxiety shows itself with in three areas of a functioning of a human beings: in a biological sphere of functioning, in the psychological sphere of functioning, and in social sphere of functioning. Let's start from the psychological component or psychological register of anxiety. As you see, it's people describe it: I feel tension, I feel worry with no reasons, or I don't know, should I worry or not? I feel anxiety, I feel fear, uncertain fear, the fear I don't know what's about. I feel discomfort, I feel myself unwell, I feel like at the wire, like taut at the wire, or I feel on the edge, I feel on the edge, I feel myself that something can happen, I got forebodings, I got expectations, something can happen, something unpleasant can happen. What? I don't know exactly, or I know, or it can happen, but it cannot, but I react at these very, very intensively. It's a psychological component. Next component is the biological component. It's a component of the sympathetic arousal. You see, palpitations, sweating, breathing, problems with the dizziness, feeling of that you go into lose your conscience, lose your concentration, losing of concentration, unpleasant sensation in a pelvis, in an abdomen, in a head, headache, can be muscle tension, trembling, a lot of things. It's all the signs of sympathetic arousal in the body. As you see, if these symptoms are sudden and if they develop very intensively, we have a case of a panic attack. So panic attack is nothing but a very intensive and very instant development of the biological symptoms. Of course, not only, but mostly we talk about biological symptoms of anxiety. Well, then you see these first two components. Of course, you can imagine a person, what he or she will do in this society, what kind of social behavior changings we will see in these patients. And the main things maybe over here, it's very common, it's voluntary and involuntary escaping or avoiding, actually avoidance behavior. Most common types of anxiety. So I don't want to go for the study, I don't want to talk or meet with the friends or something like that. I will sit in my room. Time after time, it can be aggressive behavior, not so well motivated irritation for the other people in the society, so that one. So these are three components of the anxiety, and I think all of you already also experienced an anxiety, and you will, and you have to, and it's necessary. Anxiety is the universal biological feature of all the human beings, and we need it, and we cannot live without it. Why? Because it's useful, it's good for us. It gives us the motivation, give us energy for the achievement, for the arrangement of our surroundings, to fight for the surveillance, to fight for the good, for the creation, for the creativity, to improve our life. Anxiety is really necessary component. When it is too intensive, when it is too long, when it not goes out, here we can talk about that psychopathological problems or just psychological problems of a person. Another point in the anxiety is that anxiety and depression can manifestate, can show itself only somatic complaints. So that means that things we call somatization effect. So person report for you only complaints for his body health or for the functioning of his body, but he do not aware or he don't want to think about psychiatric cause of all these phenomena. For example, then we feel anxious, especially men, anxious or fear. We have a increased heart rate, yes? So you, as the cardiologist, will meet a person, a male, for example, not only male, but the male, and the male will come to you and say, "Doctor, I have a tachycardia and the pain in my chest." You will ask him, no signs of stenocardia will be, or ischemia, no. By the instrumental test or by the anamnesis or palpitation, no, his heart is normal, is okay. Yes, increased heart rate, but this can be an anxiety because there is no other reasons. And if you ask him, you know, maybe all your complaints, maybe all your problems with the heart is due to the chronic emotional tension, he will tell you, no, doctor. Yes, I'm tense, but why am I tense? I'm worried, but I'm worried about my heart, not vice versa. So this person deny the presence of the unsolved psychological problems which lead him to the development of these sensations in the body, feelings, let's say so. And he thinks the only problem is that something is broken in his body. Very often case, and these guys will come to you, they will require a treatment. Okay, you will prescribe some drugs which reduce heart rate. It's possible, but it's useless, actually, prescriptions, because he will get back with some other complaints. We call it somatization of affect. So feelings or emotions or affect turns into show themselves, hide themselves under the physiological somatic events. Okay, very important things to know for the doctor, for the general practitioner. And let's move for another emotional reactions which are abnormal to intensive. First is phobia. So let's find the keywords over here. Phobia is a fear which is restricted for the object. So phobia, it's a fear with an address. A person, psychic, can call you the origin of these things. I'm afraid of, and they will tell you what. In social phobia, people afraid of social events, but not because of, let me to make a stress, not because of other people can harm them, can beat them, can attack them. No. In social phobia, people afraid of to be in a disgrace, to be an object for teasing, to be not for teasing, for the object of laughing. They afraid that other people would find them ridiculous, stupid, unsuitable for the society. And this fear is so strong that it starts even before something happens. And these people in social phobia, these people avoid of a social meeting in order to prevent the development of this phobia. So this phobia occurs before. Only then they start to think, they start to playing, or then only then they become aware that some social meeting is coming. So they can talk, they can meet with only familiar people, but no other people. Agoraphobia, direct translation, it's a fear of marketplace. It's a fear of big spaces with no border, these big spaces with a crowd. But that's just a translation from the Greek. Agora means marketplace. But the core features of this fear, is that these people fear to have some kind of a stroke, seizure, some attack, or these people afraid that some catastrophe will be with their health and nobody around will bring them a help. For example, if you're alone, and if you remember Osh Bazaar, too many people over there, and these people afraid that I will fall down and everybody will pass will go around me and nobody will call an ambulance because they don't know me, I don't know them, and they will think I just a drug user. That's it. Nobody will help me. Usually, agoraphobia is very common in young people, among young people. Other is specific phobia, and specific phobia is a fear which is being oriented for some isolated objects. You see, it's a fear of specific objects. Orchidophobia, arachnophobia, acrophobia. So, then we will study phobias. We will prepare yourself to learn Greek, ancient Greek language. All of them is been composed of word phobia plus the name of this object. Orchido, arachna, acro, sina. That's about dogs, blood, closet places, sharp objects, something like that. So they're afraid of that and they try to escape from them. Okay. Oh, sorry, I stopped the demonstration. Let's go again. Let's go back again. So that's a phobias. Now we move to the abnormal expression of a reaction. In these cases, people experience emotions or they don't experience emotions which we expect. Abnormal. So they react unexpectedly, abnormally, non-congruently. First is the lack of emotional response. You see that in the lack of emotional response, something happens and they don't react. We expect from them a blast of emotions, but nothing. They blank, they mute, they blank, no emotional reaction. When it can happen? It can happen during a dissociation of affect. Let's go over here. See here, sorry, where is that? Dissociation of affect. It's an unconscious defense mechanism on the overwhelming emotions, stress. It also, yes, can be described as numbness. Well, why is it protective? Sorry, forgive me, but for the cruel examples, but these kind of reactions happens in a very, very severe catastrophic events. For, I know, for example, a mother and father got the news that their son died in a car crash, catastrophe. And especially if they witness it, they just stand, look, and do nothing, like they're frozen, no emotions. Actually, indeed, there is a great and a big emotions, very intensive emotions, but these emotions are blocked and isolated from the conscience by the unconscious protections, dissociation. They take it off, put it aside, and just stand. They made a wall between themselves, their conscience, their mind, and the emotions. Otherwise, if there it would be no this wall, if we destroy this wall, these feelings will enter into the mind and there will be a blast. Emotional, physical blast, maybe they will die. So it's a defense mechanism, lack of emotional response. In case of a catastrophe, also you can see that it can be, we can meet it in derealization and depersonalization syndrome. Again, derealization syndrome, it's the syndrome then reality is being changed, usually due to anxiety. I feel anxiety and everything around me is being changed. I feel depressed and everything around me is blur, colorless, dull, etc. So I don't see that. In a depersonalization, the same. If I'm sad, I'm depressed. Nothing initiate any emotions in me. It used to do so, yes. I used to be happy that I see my friends, my family, but now I experience depersonalization. My personality is being changed. I feel nothing. I'm numb. Depressive syndrome, yes, and dissociative disorders, as I told you, dissociative disorders is a big stress. Then people just been paralyzed without any signs of brain damage, and it happens in schizophrenia, of course. In a developed and in the chronic form of schizophrenia as one of the most negative outcomes of schizophrenia. Another example of abnormal reaction is the smiling depression. Let me show you. We have a visibly smile, yes, in the people, but their eyes, yes, is being tensed. And of course, this kind of depression can hide a very, very dramatic and very dangerous condition in the patient, because he do not ask for the help, he just smile. But what actually can let you understand that something is wrong, of course, the main indicator is your feeling. You don't believe him. Well, not in terms that he's lying, he's trying to cheat you. You just feel that something else over there, something wrong over here. And I bring you the picture over here. You know this actor, yes, he's a great American actor, dramatic actor. He's a comic, great comic. Well, he's a very talented personality, very deep personality with rich and talented world, and you see that he's smiling, yes. His mouth looks like it's smiling. But the mouth is an organ which we can easily move, and we can easily use for the demonstration for the other people. I smile. That's okay, you smile, but let's do like this. To turn up the smile. And look carefully in his eyes. The eyes are sad. Like he's going to cry after a few seconds. It's a sad eyes. And eyes gives out another type of information, give another message. If you're gonna be a doctor, I know that you have already, almost of you, let's say everybody of you have this ability to feel, to understand the feelings of other person, to feel the emotions of other person, to read them. And usually we do it automatically. We take in this information without any additional mental efforts. We don't analyze it, we just feel it. Oh, we feel that he is sad. We feel that we are an undesirable person for him and we should leave. We feel the signal, leave me alone or stay with me. You're interested for me or something like that. Like the story is about to fall in love. So yes, this boy and a girl, they don't say anything to one each other, but their eyes, their mimic, their posture is screaming, so come to me and don't leave me, I want to be with you, something like that. Same here, it's a smile and depression. Apathy. Apathy, it's a kind of emotions, in the emotional indifference, yes? But the reason for this emotional indifference is the feeling of futility. It's very common in people who are in prisons, in a schizophrenia, who are in the private areas, so, and also cannabis misuse. That's a people who don't believe that it's worth to invest emotion, activity, and energy in something else, because no, nothing will come to me from this. Nothing. That's it. Apathy, it's a kind of very close to the lack of emotional response. Actually, it's a first stage of the lack of emotional response. But in apathy, we have some feelings. For example, person with schizophrenia feel that would be nice if I would go to work and find a job for me. I will improve my life. I will have money for my expenses. That would be nice. He believes in that very weakly. That's not bring him any satisfaction or a motivation. Cannabis misuse, again, person who misuse cannabis, who abuse cannabis substance, who not abuse, sorry for this, who very often use it, who is addicted to the cannabis. After some period of time of intake of these substance, they develop lack of motivation, lack of energy for all this stuff. It's pathological thing, so try to be careful with this substance next time. Well, morbid expression of emotions. So these are the emotions which people express, but they don't understand that this is a pathological condition that they have right now. Here you see a blunting of affect. Again, complete loss of emotions. Almost the same as flat affect, blunting affect. They don't care about that. It's a final development of negative symptoms in schizophrenia, or in other things, in inadequacy of affect. So in a blunting of affect, no emotional response, negative or positive for events, for positive and negative events around. In inadequacy of affect, or in incongruity of affect, social situations are misreadable. So these people experience emotions which quite opposite or really unexpected in this situation. Somebody had died, but person feels a burst of happiness. Somebody or something dangerous happens, but they're happy. So as you see, it's very often in schizophrenia. That what make these people to be strange in their eyes, in a perspective of other people around them. How can we explain inadequacy or incongruity effect? As you know that in schizophrenia we got split personality, so inside of these persons there can be some processes, some feelings, some expectations, some life, some world in which they live by their own, like in a real war. For example, it's a man who live in this world, and yes, he have a parents, but he know that this world is a wrong place. This world is dirty and useless, and he lives in a world of his fantasy in another planet. But his mother and father do not understand him because he live in another universe, and they can be there only after they die. And after they die, he will join to them mentally, spiritually. So sometimes, in this case, we can understand why a person is so happy that he can hear that his mother had died recently. Then he hear this news, because now he's happy because he will join with her in this imaginary world, in world of his own experiences, because he know that yes, average people cannot live in both places, but he live in two worlds. For example, so he has his own explanation why he demonstrates so strange and inappropriate emotions in this incongruity of affect condition. We just have to study that, and we just have to try to understand it. The origin, not to feel the same, but they understand. It's a task for the psychiatrist. Liability of affect. Liability of affect, that's usual, as you see, in organic damages. Organic brain disease. So it's rapid changes of emotions because of external stimuli. They can laugh, at the same time, after a few seconds, they will cry. As you see, it's it's a pathognomic things of a damage of frontal lobe. You see, it also can be in depression or other cerebrovascular accidents. Happy, crying, crying happy for 1 minute. And affective inconvenience, very close and very close, and actually it's a natural sibling of the liability of affect. They start laughing and they can stop be happy. They can stop themselves. But the reasons for the happiness or the jokes is already finished a long time ago, but they continue to be laughing. They also can cry. The reason for crying is lost, but they continue to cry. And they very often do realize that they cannot stop their emotions. After they started, they flow like a river, and it's out of their control. Again, affective incontinence, it's an organic brain damage reasons. Morbid disorders of emotions, and that's disorders in which pathological emotions do not spontaneously resolve after the stressor had gone. And what are they here? Depressive syndrome. But before we will talk about the depressive syndrome, we will make a small break. And after that, we will get back again for the lecture. All okay, let's move on. Depressive syndrome. maybe the main symptoms together with anxiety syndrome, which doctor, general practitioner, have to know as the part of his everyday practice. So depressive syndrome, the definition is, you see, pathologically low mood, because every one of us, we all can have a gloomy, pathological, or not pathological, gloomy and low mood, every one of us, but to the particular frame, the particular amount, for the reasons, first of all, even a bit after all these reasons, we can still be in these conditions. We can stuck a bit in our low mood, but not longer than 2 weeks without reason. If it's so, if it is more than 2 weeks, that means it's a disease, it's a kind of pathology, it's a kind of problem, psychological problem, and we cannot find yet the way out. What can help here? What can treat here? Time. Time can treat depression, as well as it can make it worse. And also, what can treat depression? Mental health professional, psychotherapist, psychologist, or psychiatrist. So, in depressive, we have 3 main symptoms. We call it depressive triad. Low mood. How person? Usually then you speak to the client, to the patient, or to the person. They don't tell you, no, I have a pathologically low mood. No, they will tell you, yes, I have a low mood, I feel unwell, not so good, not so happy, gloomy state. Wow, that's really difficult to hear from the patient. It's your conclusion usually. But usually they will tell you, I have no mood. I have no mood yet. I have no mood for 1 month, for 2 months. My mood is low. That will be a luck if you hear from them. But what will you hear more oftenly? It's a second symptom in this syndrome. It's an anergia. Yes, loss of energy. Usually they can tell you, like, you know, doctor, from the morning after I slept, and I slept almost well enough, at least the length of my sleep was quite sufficient. I have no feelings that I refresh my energy, that I have an energy. So I didn't tired yet, but I already feel myself that I have no energy to do my usual activity, to go to clean the teeth, to brush the teeth, or to clean the room, or just to have a breakfast and go for a walk, to study. No energy. And that leads to psychological, psychic, or psychomotor slowing. They really retarded. They do something slowly. They perform slowly at job, in their study, everywhere. They slow every time. And anhedonia. Anhedonia. It's a Greek word. Actually, in a Greek language, it sounds like anhedonia, but British pronunciation is anhedonia. Okay, this is an inability to feel joy. Sounds simple, but you see, then person have a low mood, have a low energy. What they do usually? They try to improve their condition. They try to help themselves. What? How? To do something. What usually entertain them? What usually give them a joy? They try and they fail. And that increase their sense of depression, the sense of loss, sense of crisis. This is a try. Try that, yeah. Anhedonia. Also, there are a number of symptoms, and these symptoms, actually, we can say that that's a secondary, or it's a consequences of all the triad. And as you see here, difficulty in making decision. They cannot make decision properly. They have no courage, looks like. They doubt. They have no power. They're afraid. They have problems with the attention, with the thought, troubling thoughts. Unpleasant thoughts usually come in without any invitation, but they have that. Anxiety, yes. Diurnal means the most acute symptoms of depression. Most unpleasant, most intolerable period of their time is the morning. That in the classical depression, right now we haven't much a classical case of the depression. They also have a loss of appetite and loss of weight. You know, meal, it's a source of joy, big source of joy, and no pleasure. Nothing tasty, like a plastical mass I'm eating. It's not a, how do you call it? It's not a chicken masala. No, that's something even just a mess to support my biological need. Loss of libido, no sexual desires, no sexual activities, or loss of sexual activity, or less of sexual activity, or problems with the fulfilling of sexual activity in a man or in women, painful sensations. So they don't need sex, they don't interested in this kind of joy. It's a big source of joy actually for human. And sleep disturbances. Classical, it's very difficult to support the sleep. They wake up early in the morning, 4 or 5 o'clock, and they cannot sleep anymore. They want to sleep, but they cannot sleep anymore. Also, other types of sleep disturbances are possible. Next is quite opposite phenomenon. It's an antonymous for the depression is mania or hypomania. Hypomania is the same as the mania, but it's not so prominent, not so intensive. And you see, the definition is over here. And please be careful, do not mix people with mania, do not mix these people with maniacs. Somebody who is obsessed with, I don't know, with something negative. No, people with mania, they have an elevation or excitation of mood and energy, and nothing, even very, very bad news, very events can influence their mood. So again, in the mania, we have 3 main symptoms. Mania triad. What is that? It is heightened mood, euphoric or irritable. Heightened mood, elevated mood, usually euphoric. They feel themselves very well. They feel themselves happy, pathologically happy. That's it. No reasons required for that. No great mucks for the students. No notes, no letters that you been enlisted in our best in the world university. You're gonna be a cardiothoracic surgeon. Welcome. No reasons in need for that. They can be happy so much from, I don't know, that have some cake or something like. No reasons. Elevated mood, psychomotor activation, energetic activation. Remember depression, high energy, and high energy everywhere. In motor activity, in mood activity, in speech activity, in ideas, in thinking, in emotion, in sexuality, in motivation, everywhere a lot of activation. And increased energy and decreased need in sleep. Where is that? My 2 hours will be enough to be fresh. If you live together in the same hostel with them in the same room, so your roommate with mania, he will wake up at 3 o'clock in the morning and he lay down at 12 o'clock if you're lucky. So he will sleep 3 hours a day, and then he will wake up, but that's not enough for him. He's talkative, he's communicative. He will come to you and say, why are you sleeping? We're losing our time, we're losing our happiness. we lose our possibilities. So let's make exercises and go study, find something, initiate programs or a project or something like that. So that will be that energy will be intolerable for you and for the relatives as well. Of course, as in depression, we have additional symptoms, a lot of them, but here are the main 5 ideas. Yes, thinking is over speed in too high speed. They think fast, they have idea, and you see that ideas have a kind of racing competition, and he run from one idea to another. It's a flight of idea. So activity, a lot of activity, and it's superficial, as you see. So they can start now at the 3 o'clock in the morning exercise. Okay, they will do it for 5 minutes, then they will decide it's time to be a brilliant surgeon, and they will start to read anatomy or surgery textbook. After 5 minutes, again, after 7 minutes, they can think, no, I'm gonna be a great pharmacologist, and start to study pharmacology, so, or to call somebody. So they really been distracted, very easily distracted. Hypersexuality, yeah, so they think they are, nobody can deny them, nobody can reject them, and so they can see somebody who is handsome or pretty, that's not matter, is it a girl or boy, so they will come to them, and they will think that other people will follow them and will be easily be involved in a sexual activity just because they are so nice, brilliant, and sexy, so attractive. So they believe in that, and they usually find the partner because their hyperactivity, hypersexuality can really be charming, and it works, but it's a promiscuous relationship, so it's dangerous, especially for women, because they very often provoke, they very often make an advertising of a great sexual activity for the men, and then they change their mind. They got a lot of problems, including physical abuse for them. So that's very dangerous symptoms for them. They talkative. They have initiate a lot of project, a great project, like a great business. They can come to you and say, oh, how much money do you have? Let's all your parents will sold out all their property, and we will invest here in Kyrgyzstan to sell, I don't know, masala, Santa, and all the nations very soon will adore our production, and we're gonna be rich, more rich than Bill Gates. After a few days, not few days, okay, 3 months, half a year, we will be more successful than him. And here, delusions. I hope you remember that delusions is a false beliefs, yes? And these people have grandiose delusions. This we can find in mania. In a hypomania, no, because, well, not enough inflow of energy, not enough activation yet. But in mania, energy goes beyond the threshold, so, and they have delusions. They believe they got a magic abilities, or they are a god, or they are a doctor, for example, who can treat any disease in this world, any. And they can believe that they are God, and they can turn back that people from other world to this world. A lot of things. They believe that everybody loves them, and most movie star Shah Rukh Khan, I don't know, love them or something like that. So that's that's where we can meet in hypomania. Hypomania and symptoms of hypomania, yes, you see, can be in bipolar disorder, of course, in mania, hypomania, but also in brain lesions and stimulant drug use like cocaine or like LSD. In this case, we can see the symptoms of hypomania. Euphoria. Euphoria sounds like the same, but with no energetic activation. These guys, they're happy, intensively happy, but they are at the same calm. They feel joy and great relaxation, including muscle relaxation, including including stable mind, stable set of the mind, stable activity, stable tonus of the muscles, for example. Of course, it occurs, as you see, classical symptom of euphoria. It's an abuse of opiates in some organic brain damage, especially in a damage of the brain or the frontal lobe in the brain. That's euphoria. Unmotivated happiness, but calm happiness. If these damages will go further, and if they not only happy, relaxed, but if they make a silly things, stupid jokes, if they control their behavior like not a small child, like a spoiled, naughty child, like I don't know, an old man, become very happy, nice, smiling, and he start to masturbate, or he starts to initiate a sexual sexual proposals for everybody around him. So this is a moria. Moria means last stage of euphoria. That means actually it's accompanied with dementia. And ecstasy, as you see in the definition, ecstasy, well, sounds like it's a excited states of feeling. It's an extreme well-being. Accompanied with the rapture, quite a bit. Excitated states of feeling. So people are on the edge, something like you push them up from the high, and they feel, wow, an ecstasy, like an instant light, instant discovering, instant insight, like not like a full of air. They feel in a rapture, a grace. Well, and of course there is no elevation of mood, there is no hyperactivation. It can happen, you see, in religious ecstatic experiences. Here an example, mass hysteria, but yes, in mass hysteria we can call it, but if a person practicing is been practicing religious practice, and he is doing it for a long time, he is very great follower, he is really involved in that, he work hard, and after that he can achieve the highest point of his, I don't know, highest point of his perfection, of his practices. Like in yoga, it's an ecstasis, it's a nirvana, so-called. It can be these, of course, it's a positive things, but ecstasy very often is accompanied like with a pathological, in a pathological ways, due to, for the pathological reason, due to drugs, or due to schizophrenia, due to disease. So in schizophrenia, they can have an instant discovering, an instant insight. For example, I felt myself not so well. I feel that something is going on with me, but wow, now I know I'm a Messiah. I'm a prophet. Not a prophet. I'm more than prophet. I'm Messiah. I came to save this world. And I feel, yes, and I feel ecstatically myself. Of course, that's a pathological things, but they really happy, extremely happy. Okay, so that's, I think that's it's the end of the yes, that's the end of the material. And now we finish this material with the emotional disorder.